All right, in this video, we're going to be talking about femoral retroversion. If you haven't watched my previous video to determine whether you have femoral retroversion, I'm putting a link to that right up here. So please watch that first to determine whether you even have this condition. Assuming that you've watched that video, you've now found that you have femoral retroversion, which means that your thigh bone is twisted outward. And so we're going to talk about what to do in this situation. The interesting thing about femoral retroversion is that more men than women typically have this phenomenon occurring. So let's talk about how femoral retroversion causes pain. So if you have femoral retroversion, I would like you to stand up right now. And we're going to stand here for maybe 15 seconds. Okay, now I want you to look down at your feet. Are your feet pointed forward? If you have femoral retroversion, like I said, it means that your thigh bone is twisted outward. What has happened with most people is that we are socially conditioned that our feet should be pointed forward when we're standing and walking. If you have a thigh bone that's rotated outward, that means that in order to point your foot forward, you are relatively internally rotating that thigh bone. What happens is that this then causes your inner thigh muscles, your top of your thigh muscles, it causes a lot of tension in the pelvis and the spine and even the hamstrings, because it takes a lot of energy to rotate this thigh bone in against the shape of the actual thigh bone. Let's experiment with this idea for just a second. What I want you to do now is stand up and just feel what your legs feel like here. Now what I'd like you to do is go ahead and turn your feet out maybe 3 to 5 degrees. And I want you to notice how your legs feel in this position. Go ahead and bend your knees a little bit and feel how they move. Okay, now what we're going to do is I'm going to ask you to turn your feet back to where they normally are, pointed more forward, and I want you to feel the tension in your legs in this normal position for you versus when your feet were pointed out. I want to take a little break here and ask you to please subscribe and like this video if you find this information helpful. And most importantly, please share it with others who have pain. These are important concepts that can really help a lot of people. Thank you. Go ahead and try it again. Point the feet out and then point them forward again the way they were when you first started. Most people will find that they're feeling much more tension in their legs in order to keep the feet forward. This then causes a lot of stiffness, groin pain, hip pain, knee pain, foot pain, all sorts of problems in the legs. But all those problems come down to the fact that you have femoral retroversion but have been trained to point your feet forward instead of allowing your feet to rotate to the outside. How much should you rotate your feet to the outside? Only you can make that determination, because everyone has different degrees of femoral retroversion. So the tough thing about having femoral anteversion and now understanding that your feet should be turned out a little bit is that socially we are trained to see this as quote unquote walking like a duck. Well, of course, no one wants someone to say that they are walking like a duck. That saying is coming from a lack of understanding of femoral anteversion and femoral retroversion. Those of us with femoral retroversion need to point the toes outward in order for the muscles to be more relaxed and decrease joint compression at the hip, the knee, the SI joint, and even the feet. Think of it like this. You are now walking with your feet aligned with your femur shape. And if anyone comments on this, you can just tell them, look, I've got a medical condition. It's called femoral retroversion. Know about it? Well, here, let me send you this great video that explains it. That's really the big thing that needs to happen with femoral retroversion, is that you simply need to start pointing your feet out. And I bet you'll notice that a lot of your chronic aches and pain and tension in your legs will start to melt away as a result. Now, the next video in this series is talking about chronic tension, which is a big issue with chronic pain. That video is up here. If you'd like to join my free masterclass, where I take you through some tests to understand your back, sciatic, and SI joint pain, that link is right here too, and I hope to see you there.